Today we'll be seeing how to make an ideal sight port with the help of 20 gauge MVR. So here see that we are entering just at the junction of white sclera and the cornea, that is limbus, without involving any of the conjunctival layer, so that you do not have chemosis during the surgery. It has to be a stab incision without any hesitation, so as to have a clear edges of the wound. This helps us to not have DMDs and avoid any negotiations while entering through the sight ports. Also, 20 gauge sight port is helpful to avoid any leakage of fluid during the phacoemulsification, and it will be beneficial when you do sight port hydration at the end of the case to achieve a tight wound closure. Now here, before performing rhexis in the case of mature cataract, we would like to stain the capsule very well to have a good visualization during the surgery. So we wait for at least a minute or 2 minutes to get a good staining. Then we wash blue dye sequentially and try to hydrate the port so that we have a tight chamber while staining. As you can see here, the port is looking nice, rectangular in shape with all the walls of equal size, and the inner edge of the side port is looking linear. It is also important to know that whenever you are entering through the port, you should enter in the line of the wound so as to avoid any negotiation, as you can see here, and also exit in the same line. While making side port, we also make sure that it is exactly perpendicular to the circumference of the limbus. Now I'll be showing you how to make an ideal cystotome in such cases. You bend the 26 needle inside so that you have at least 1 millimeter of a tip which is exactly perpendicular, so that you get a good grip on the capsule when you are performing rhexis. See how you enter without any negotiation at the side port to avoid any DMDs and disturbance in the wood architecture. Now we took a nick. Observe how we exit through the side port. After taking a nick, we are aspirating the liquid under the flap with the help of hydrodissection cannula and a 5 cc syringe. We also grow from the opposite side of the side port. See here, the ergonomics and the location of the side port is circumferentially and is exactly perpendicular to the circumference of the limbus. Make sure you milk out all the liquid cortex and iron as much as liquid you can iron towards the neck, and aspirate whatever amount of milky fluid you can aspirate to have a good rhexis. Now we are injecting sodium hyaluronate to have a good anterior chamber pressure. Now we'll be aspirating the air bubbles so we have a very good visibility. So after injecting sodium hyaluronate, we will again enter. See how we are entering through the side port without much of a negotiation. We started from the opposite side as we felt that this is more approachable. See the movement of the cystotome, it was pulling, then flattening the flap as you want the rhexis to progress. Observe every time we flatten the flap, and the edge of the flattened flap helps us to guide where the future rhexis will head towards. See here. So now you can see we will be completing rhexis, and observe the moment at the fingertip. Every time we exit the side port, make sure that we do not tear the posterior lip of the side port. Now we are making a main port entry at the limbus, slow and gentle and entry. Thank you.